I well understand the anger, grief, and fear of the Israeli people following the horrific attacks 2 months ago. I also understand the anger, grief, and fear of the people of Gaza who had already suffered through 16 years of blockade and are now enduring the destruction of their families, their homes, their communities, and the life they knew. Dr. Mike Ryan and his team will provide a more detailed presentation on the health situation in Gaza, but it's stating the obvious to say that the impact of the conflict on health is catastrophic. More than 17,000 people are reported to have died in Gaza, including 7,000 children. And we don't know how many are buried under the rubble of their homes. More than 46,000 injuries have been reported. 1.9 million people have been displaced, almost the entire population of the Gaza Strip, and are looking for shelter anywhere they can find it. But nowhere and no one is safe in Gaza. As more and more people move to a smaller and smaller area, overcrowding combined with the lack of adequate food, water, shelter, and sanitation are creating the ideal conditions for disease to spread. On average, there is one shower unit for every 700 people and one toilet for every 150 people. There are worrying signals of epidemic diseases, including bloody diarrhea and jaundice, and there have also been reports of high levels of diarrheal diseases and respiratory infections. The risk is expected to worsen with the deteriorating situation and approaching winter conditions. Gaza's health system is on its knees and collapsing. Only 14 hospitals out of the original 36 are even partially functional. 2 north of the Wadi Gaza and 12 in the south. Only 1,400 beds are available out of an original 3,500, while about 2/3 of primary health care centers are non-functional. The 2 major hospitals in southern Gaza are operating at 3 times their bed capacity, running out of supplies and sheltering thousands of displaced people. Meanwhile, more than 180 women give birth in Gaza single every day. There are 2,000 patients on cancer therapy, 350,000 patients with diabetes, heart disease, and hypertension, and at least 20,000 civilians in need of acute psychiatric care, and many more are expected to suffer from severe mental disorders as a result of the conflict. I visited Al-Shifa Hospital in Gaza City 5 years ago, in 2018. I toured the dialysis ward and the neonatal intensive care unit and spoke with health workers and patients. Even then, conditions were extremely difficult for health workers and for patients. Now, the work of the health workers is impossible, and they're directly in the firing line. Since the 7th of October, WHO has verified more than 449 attacks on healthcare in Gaza and the West Bank, and 60 attacks on healthcare in Israel. Healthcare should never be a target. I also grieve the loss of more than 100 of our UN colleagues in Gaza, including our own Dima Al-Hajj, who was killed alongside her 6-month-old son, her husband, and her 2 brothers. In summary, health needs have increased dramatically, and the capacity of the health system has been reduced to 1/3 of what it was. WHO is on the ground in Gaza, alongside our partners, to support health workers who are physically and mentally exhausted and are doing their best in unimaginable conditions. By the way, today I have Rob Holden with us, who just returned from Gaza, our colleague Rob Holden, and our regional director, Dr. Ahmed Al-Mandari, and his team are also with us for any questions you might have. They can give you the first-hand account of the situation. Resupplying these health facilities has become extremely difficult and is deeply compromised by the security situation on the ground and inadequate resupply from outside Gaza. Humanitarian agencies are struggling to cope. The resolution you're discussing today, if adopted, asks me as Director General to do several things: to report on the public health implications of the crisis, to assess the extent of psychiatric morbidity, to strengthen technical and material assistance, and to strengthen our work with partners. But I must be frank with you. These tasks are almost impossible in the current circumstances. Indeed, it's for that reason that the Secretary General last week invoked Article 99 of the United Nations Charter and called for a humanitarian ceasefire. I echo the Secretary General's call, a call I have made repeatedly myself, including during my report to the Security Council 2 weeks ago. A ceasefire is the only way to truly protect and promote the health of the people of Gaza. I deeply regret that the Security Council was unable to adopt a resolution on such a ceasefire last Friday. I know that negotiations on the resolution for this meeting have been difficult, but I very much appreciate the spirit of cooperation and compromise you have demonstrated, and I welcome your commitment to finding consensus. It's only through dialogue, mutual understanding, and finding common ground that we can ever hope to find a resolution to this crisis and to the many other crises in our troubled world. This year is our 75th year as WHO. The opening words of our Constitution remain more relevant than ever, that health is a fundamental human right for all people, and that health is fundamental to peace and security. I urge you to use this moment to fulfill that vision, recognizing as our founders did in 1948, that there is no health without peace and no peace without health. So I hope you will use health as a bridge for peace. Thank you very much. And Chair, back to you.